over to the incredible Dr. Cheryl Tien. All right, it looks like it is being live streamed. So why don't I go ahead and kick us off? Thank you all for joining our Survivor Support Summit. I understand I have no video right now, but I'm just like trying to make sure that everything is going swimmingly. I apologize for the delay. It is what it is. But thank you all for coming. This is our, I believe, fourth Survivor Support Summit. And this was kick us off. Thank you all for joining our Survivor Support. Oh my God, I'm so sorry. Wow. Yes, so we're going to go ahead and get started at this moment. My name is Carrie. I'm the founder of Asian Mental Health Project, and I'm so grateful to the team for putting this together. Particular gratitude to Jenny Luo, who has produced this event, and then of course Dr. Cheryl Tien, who is our on our clinical advisory board and things. So throughout this session and the sessions today that are virtual, feel free to chime in the chat as well as Q&A. We will gather questions throughout the session, but we'll probably allot for like 10 minutes at the end of the session for questions from the audience if they need. And if we don't get to your question, we'll try to answer it, in a post event email and or in the chat. But again, we're so grateful to everybody for joining in. I will go ahead and turn this over to Dr. Cheryl.
Good morning, everyone. It's so lovely to be here with you all today on our fourth annual Survivor Summit. This is so exciting. My name is Dr. Cheryl Tien. I am a psychotherapist in the San Francisco Bay Area. I'm a certified psychedelic assisted therapy provider. I'll talk more about that later. And as Carrie said, I am on the clinical advisory board of the Asian Mental Health Project. I first found the Asian Mental Health Project in the pandemic, like many of us did during the original Wednesday night stay-in check-ins. And for me, it was like a huge, just grounding moment. I was seeing patients in the pandemic over Zoom. We were locked up. It was a weird time. And the stay-in check-ins really helped me feel like I could serve the community and have a larger impact. So I was a participant at first, and then I facilitated a couple stay-in check-ins. And then since then, I've been with the Asian Mental Health Project in my clinical advisory position. Um, I guess I don't even know when we made it official, but probably the end of 2020, beginning 2021. Um, For those of you who are unfamiliar with me and my work, I have a doctorate in clinical psychology. I've been a therapist. I have a combination of being a therapist, working in health administration in a social services setting in mental health care for about 14 years now. I started when I was a baby. I was somebody who knew that they wanted to be a psychologist pretty early on in my life. So went to college, thought I was pre-med, went into psychology and never looked back. This particular day is really important to me because in the span of my training, I've had the opportunity and pleasure of supporting survivors of domestic violence and sexual trauma. I am a survivor of sexual violence myself. Um, and that really, I think, un I think many people share the story in that, like, I minimize my experiences as a survivor because it was a friend, because they were drunk, because they didn't mean it. And then when Me Too happened, um, my whole perspective of that experience really shifted. And I actually ended up doing my dissertation research on the impact of Me Too on reasons for sexual violence disclosure. So it's so special for me to be here this morning to be kicking off the day, especially in the context of what Simone Biles and Suni Lee have accomplished at the Olympics, particularly with Simone Biles. Um, for those of you who don't know, USA Gymnastics had a huge um, sexual violence scandal with one of their providers who did fortunately have to, pay for their crimes. So it's very special for me to be here in the context of healing and survivorship and just being able to celebrate that joy. Um, I am here today to talk to you about various treatment options. Um, and I want you, as we get the day started, to um, think about how this information could serve you either as a survivor or you as a supporter of somebody who is a survivor. How do we help people heal? How do we, as a community, uplift voices that have been quieted? And how do we spread love and joy and respect and advocate and work toward a world free from sexual violence? So I'm going to start off by giving you a disclaimer. I am a psychotherapist. I am seeing patients. However, any information that I give in today's presentation and today's workshop does not constitute as professional mental health or medical advice. It's meant for education. Also, there's going to be information that I talk about here that is informed by by research, what I see in my clinical work, as well as my lived experiences. So that being said, I am a cisgendered Asian American woman with quite a few resources to education. Um, and like stable housing. So I'm coming from a place of both privilege and marginalization. I'm a daughter of immigrants. So I have one experience and I'm speaking to my experience and what I've seen. Other people will speak to different things. When we start getting into the psychedelic training information, that will be particularly important because I have a very Western style training and that I went to traditional like accreditation schools and then I went through a certification program for my psychedelic education. Um, Other people came about their psychedelic facilitation skills in other ways, which I will get into. I don't know how possible this is, but if it is possible, I invite everyone to in the chat just so that I get a sense of where the knowledge is for our participants. If you could say from a scale of 0, you know nothing about psychedelic therapies, to 10, you know quite a bit. Maybe you are a psychonaut, or maybe you've like tried psychedelic medicines before. I'd love to get a sense of just where we are as a group, if that's possible. I'm seeing that the chat is disabled. Okay, never mind. I will skip that just for yourself. Think about that. Um, I'm going to do my best to be as informative as possible. And in the Q&A, I have it open, so please feel free to like write questions. And if I happen upon them, I'll talk about it. But uh, we will save time at the end. And Carrie, if there is looking like there are a lot of questions, feel free to just ping me and let me know, and I'll make sure that I can try to save more room at the end for it. Okay. I'm going to start with my personal journey with psychedelics because I have found that that is where people are able to understand the potential of psychedelics first. I started my journey with various plant-based medicines and psychedelics um, early on in for about 10 years ago when I was dealing with a lot of anxiety and depression and the available treatments to me just like weren't cutting it. I was in school to become a therapist, so I was the person in therapy who was like talking, but also every time my therapist would respond to me, I knew in my head what technique they were using or what um where they were trying to lead me, and it just felt like I couldn't get out of my own head and couldn't like fall into the process because I felt like I knew too much about the process because I was academically learning about it. I found plant medicines and um, sat with these medicines is the term that we use um, in community with close friends recreationally, which I don't love that term because I think people who ingest these medicines recreationally are actually trying to do it for wellness. And there's a line between you know, there's a line between partying and having fun and trying to get blasted and versus like trying to allow yourself to have a elevated experience. So that was how I started. And then My husband, who had dealt with treatment-resistant depression since before I had met him for over 10, for 12 years, um, we were able to get him into ketamine infusions, which we could afford after moving to another state for a while. And the changes in him that like I hadn't seen in like the 8 years we had known each other started happening really quickly. Even in the first few sessions, but I didn't want to say anything. And he did a total of 12 sessions. And by the end of the like 3, 4 months, he was such a different person. Um, he told me he thought his depression had gone into remission for the first time in over a decade. And it had moved me to tears. And after what he had gone through, I got tapped into a psychedelic society in Vermont, which is where I was at the time, and joined in on the reading groups, learned about other people's stories, kind of got immersed myself in the community, and really was able to start seeing it as a potential to like really help people heal, not just put them through the ringer of the mental health system, but really see how it could help people heal. That was in, I want to say, March of 2022. And at that point, we had both, as a couple, dabbled in plant medicines and psychedelics for a long time recreationally. And then, like, to see how doing it on our own with friends compared to like what could happen within like a container of a therapeutic space really helped me understand that that was what I was going to do next with my career. So I enrolled in a training, I became certified, and now I'm kind of just waiting for the government to figure out what they're going to approve and what other pathways people have. Um, so I'm going to start by just talking a little bit about what other treatment options are available to survivors. Here are some ground rules. Um, I don't think psychedelics should be a first line of treatment. In fact, I think that people who have gone, I have found that people who have used psychedelics as the first line of treatment actually don't get as much benefit as they hope, as other people talk about. So my broad strokes education recommendation for, without knowing your specifics is that if treatment is something you're interested in, I highly recommend starting with regular talk therapy. The reason for that is because psychedelics change the way you think about things. And I have found that it is really important to have practiced the muscle of going to a talk therapy session, sitting down, reflecting on your life, and building the muscle of developing a close therapeutic relationship with a therapist. Um, and also just being in practice of either journaling or other coping strategies. So, the first line treatments that I would actually recommend for people to consider exploring are one, talk therapy. There are a couple different techniques that we have found to be useful. Um, that being said, largely what I understand is that it matters less what technique or intervention type they use, the type of therapy used, but rather the relationship that you have with your therapist is the most important. So, cognitive behavioral therapy, CBT, is one of the most widely researched interventions that we've done. It's really effective in treating PTSD and trauma because it focuses on the relationships between thoughts, feelings, and behaviors. It helps people identify and challenge distorted or unhelpful thoughts related to trauma or even who they are as a person. Um, Through CBT, if you're not familiar with it, you learn to sort of reframe your negative thoughts with more positive and realistic ones. We call it cognitive restructuring is the fancy term. Oftentimes, survivors have a hard time accomplishing tasks. And so another technique people use is something called behavioral activation, where your therapist works with you to try to just get you moving, setting small goals so that you can start moving again. Some therapists do exposure exercises through CBT, through re-experiencing things in a way that feels like you can reprocess that memory but not be so tied to it and get like such a severe emotional reaction to it and just like habituation. It can really help with PSD symptom management and help develop coping skills and strategies and start building resilience. On top of CBT, there's also something called trauma focused cognitive behavioral therapy, or TFCBT is the term that you might see. Um, it was specifically developed for kids and teens who are healing from trauma. It was also developed for family members to support teens and kids, but people have used it and adapted it for all kinds of different things now. It helps survivors cope with their trauma, and it also helps caregivers to better understand how the trauma has impacted their kid or their whoever they're caretaking for. Um, it's phased out into three different stages. So the first one is stabilization. And in that first phase, you're not talking about your trauma, but you're rather just like stabilizing your symptoms. So this could be really good for you if you're somebody who's going through panic attacks, feeling like you're really struggling with regulating your emotions. Maybe you're having crying outbursts or angry outbursts. In the stabilization phase, it could really help just bring things down a bit so that you can breathe through it, express your feelings, do some relaxation techniques. It focuses on coping with the trauma symptoms and starting to teach people how to process the negative thoughts and beliefs that might develop. In the second phase is trauma narration or processing. There, survivors will talk about their trauma directly and it's guided by their therapists. Um, when I do this part, some therapists have clients like write it out or draw. And so it can really help to do it with a therapist, like in writing it or drawing it as a medium of like creating art. I had a mentor once talk about how they worked with somebody and that survivor was really artistic. So they made a comic book to reprocess their trauma. So it can be really empowering. And then in the main area of that is to like learn how to view their trauma and their memories of it without having their fear of it so closely tied behind it. Um, in that phase, if it's a kid or a teen, the caregiver can also help gain a better understanding of what the survivor had gone through. And then in the third phase is integration and consolidation. Exposure therapy might be used at times where they incorporate learned skills into their daily life and develop future safety plans. It could be really helpful at this time to like reintroduce triggering environments or objects like in the therapeutic space to help disconnect that relationship. It could be visiting a location. It could be, eating something that reminded them of the event. But it's there that they learn how to move on and live with their lives afterwards. There's also something called prolonged exposure therapy. PE is how it's abbreviated. This is a type of cognitive behavioral therapy where in a controlled environment, clients are repeatedly exposed to triggers both in real life or through visualization. This repeated exposure helps individuals process traumas to reduce avoidance behaviors, which is common. It can be very effective. Um, Something to consider is that the survivor have very good coping skills set up so that because they are reactivated, they can make sure that they have the internal resources to manage the exposure therapy. There is also EMDR, or eye movement desensitization and reprocessing therapy. This might be something people have heard of quite a bit. If you haven't seen a video of it before, the most common way that it's portrayed is there's like a bar with like an LED strip of lights, and there's just a light kind of going back and forth. And the idea is that you watch the light and follow it with your eyes. There's also like tapping that EMDR specialists engage in, and it's to like move the body while you're talking about things to help process the traumatic memories. That also can help with grounding. EMDR starts by a few sessions of like talking about your trauma history and those memories. And then, like, after you talk about it in the initial sessions, you don't actually talk about it again. So during the actual EMDR sessions where they're doing the eye movement or the tapping, there isn't talking about the trauma, but rather just thinking about it and about the memories in your head while doing the eye movement desensitization work. And so some people really like that because talking about your trauma can be really re-traumatizing. Um, and so EMDR has been really helpful to folks who find it difficult um, to talk about their traumas. Okay, so those are some of the talk therapy options available to people. I'm going to get into the psychedelic stuff. Right now in the United States, the only legal psychedelic um, intervention that is widely available in most states is ketamine therapy. Ketamine therapy can come in a lot of different forms. There is IV ketamine, where you go into a clinic and they infuse you with like an hour-long drip of ketamine. There's also IM, which is an intramuscular injection. You still have to go into the clinic for that, and you get monitored by a provider, and you get an injection for that. With ketamine therapy, typically you it can be quite expensive. Here in San Francisco, for example, if you don't get it all within one house, which is how I provide ketamine therapy, I provide preparation and integration of ketamine infusions, and I partner with ketamine prescribers in the area. So I'll either they will meet with the patient or a client and refer them to me, and I'll have a couple sessions before the infusion to prepare them for their ketamine experience. They'll go off, get your ketamine infusion, get the ketamine infusion, and then the next day or a couple days later, we'll have a therapy session before. So it can be quite expensive because insurances don't really cover it unless you have very, very good insurance. So you're paying out of pocket for both therapy here in San Francisco as well as the ketamine infusions. Here in San Francisco, infusions run about $800 per infusion. It's that expensive. Like it's not the medication that's particularly expensive, but rather it's the number of providers. So I work with anesthesiologists, I work with medical doctors, and then the talk therapy is an added fee. So it's largely inaccessible. There's, I think, one other clinic that does sliding scale fees here in the Bay Area, but even then, it can still be quite pricey. I think it's still over or like $1,000 per session if you think about all the people that have to be involved in making sure that works. Um, MDMA, it is what is kind of being uh, going through the FDA approval process right now. It has been largely used to study PTSD for veterans primarily, although other clinical trials have also looked at general PTSD as well. And there's new studies every day looking at other symptoms. I know OCD is happening right now, and other diagnoses for MDMA. MDMA is really interesting because the only protocol that was being submitted for FDA approval was through what used to be the Multidisciplinary Association for Psychedelic Studies, or MAPS. They're now called Lykos Therapeutics. Um, their model, which is publicly available, is the use of two therapists with one client. So again, that can get very pricey because you're paying for the time of two therapists. And the length of time for MDMA is pretty long. I think that a whole MDMA like medicine session while you're under the medicine can be anywhere between 4 to 6 hours. And then you have to do your like blood pressure monitoring and your intake beforehand. And then afterwards, it's not like you just come out and they send you home. Like, yeah, you talk to a therapist afterwards, you like go through what happened. So you can be in treatment for a day for up to like 8 to 10 hours. And so when you're sitting with somebody, just imagine paying for somebody's time, two people's time, two licensed people's time to sit there. So also something that we as a community are going to have to figure out um, in the future if we're really going to legalize this and make this more widely available to people. There are also currently psilocybin studies or magic mushroom studies, shrooms, which is also something people colloquially know it as. Um, that has is more popular in areas where things have been decriminalized. So here in San Francisco, in the Bay Area where I live, psilocybin has been decriminalized, and so it's like very widely available around here, which is not true in all parts of the world or the country. Um, Psilocybin is just now being researched in the Western world, but there are millennia of information in indigenous populations throughout North and South America, particularly, who of shamans and healers in indigenous communities sitting with the medicine. Psilocybin is something that I think should be better researched and more widely available to people. Um, Hot take. I believe that one of the reasons why MDMA is getting so much attention from the FDA rather than psilocybin right now is because MDMA requires a pharmacy and we have to be compounded. So think about big pharma and the ecosystems that we have that push out these medications, whereas psilocybin is a mushroom that, if given the right conditions, anybody can grow. So things to keep in mind if you're interested in exploring psychedelics, there's a lot of ethical conversations and dilemmas that we as community members need to be having and thinking about. It's another workshop. Now, if you are considering psychedelic therapies, a couple things I would want anyone to know is that psychedelics are non-specific amplifiers. What that means is they bring up what they can help bring up what is sort of bubbling underneath the surface. So if you were to think about your brain and your consciousness as this is your consciousness and this is your unconsciousness, I think psychedelics is the medicine that helps dissolve that line between your unconscious and consciousness to help you understand a little more, just to like get a little bit deeper, to like break through that stuck point. That being said, we don't get to pick and choose which stuck point we want to work on. And so I've had clients come in and say that they wanted to work on one specific trauma, and then a trauma from something else came up and had to be resolved first. And so in preparation, you want to be thinking about how, like, is that something that you would like to risk? Because in preparation, we like try to like set guardrails as much as we can, but the medicine reveals what the medicine reveals. We don't get to decide. So, is that something you're prepared for? There are also a variety of trainings in psychedelic practitioners. So, like I alluded to earlier, I did completed a certification program, and I found one that specifically touched on all the psychedelics that are being explored right now. I also got trained through Lycos as well. So I'm MAPS or Lycos Therapeutic MDMA education, trained, and then I also got trained through the Integrative Psychiatry Institute. There are other training programs that will send providers on like a 2 hour or a 4 hour workshop. If you think about the difference between like a year-long training, my lived experiences, and my 7 years of a doctorate program compared to some other trainings that are out there that I found that are like a 2 or 3 hour webinar. and then people are like, I'm good to go. I'm a certified psychedelic therapy provider. So there's, if you were looking for a psychedelic therapist, either above ground legally or off the grid underground, where it's a more legal gray landscape, um, the biggest question I recommend people to ask their potential facilitators is, what degree of training do they have? Now, that being said, education is really expensive. My psychedelic training was a huge added cost, even after finishing uh, my graduate program that left me six figures in student loan debt. So I know facilitators out there who are able to charge less because they don't have that debt and they were trained in the Amazons or Peru by shamans. And so things for you to consider about what's important to you for if you were to look for a facilitator. Um, Now, when we think about above ground or underground facilitators, things that I think about are if you have an above ground facilitator, and again, like I said, right now, the only easily accessible above ground psychedelic therapy people can access is ketamine. Um, Cannabis too in some areas, but that's less known, so I won't focus too much time on that, but is ketamine. And you can do it through an IV or at a clinic. They also have home ketamine mail programs. I don't recommend those. Certainly not if you have a complex trauma history. Um, I have a lot of questions about that. I think that that leaves too much room for abuse. Ketamine can be very habit forming. So I didn't talk about it at the top, but there are like oral ketamines that you can either spray up your nose, and it comes in like a nasal spray, or like orally where you have to swish it in your mouth. Um, you can get it for at home administration, and then get integration work either later, but those tend to be less effective because the way you ingest the medicine leaves room for a lot of error. So, like the dosing is imprecise a lot of the time, unless they like people have to train you how to spray or ingest it properly. Um, and so normally like when people ask me which one I would recommend, like generally I would say like if you really want precision, like IV or IM ketamine at a clinic where you're monitored is going to give you more bang for your buck. That being said, yeah, healing in a medical facility isn't always everyone's jam. So in the underground, there's a lot of different locations. There's psychedelic retreats, where you go off and there's like a home and like you stay there for a few days and it's like ceremonial and it's in a group. It could be in a group setting or in a private setting. Or like some facilitators will go to your home, set you up, and there's pros and cons for all of that. What I like about either retreats, what I like about retreats is that it really takes you out of your environment. And so from like a prep and integration setting or preparation setting, it could be helpful to just pull you out of things. Um, and then for integration, you can usually they are there for a few more days after the experience to like help you soften and make sense of what you learned. The hard part about that is again, travel expenses, not easily accessible, but also I have found that um, not doing it in your home, and like going off and coming having to come back home, like then transition back into your regular life is harder. Um, Sometimes I think that it makes it so that it's harder to just implement the insights that you made under the medicine because you kind of had this magical, mystical experience, but it was like within this context of like a vacation or a resort or like a retreat center. And so it can be really hard to like integrate everything at home because, you know, it's so beautiful out there. That being said, I think it can still be a great jump starter. So just like be mindful of the pros and cons of these things. Um, I can appreciate home visits because it's helping somebody in their trauma like at their home. Now, the downside to that is if the home isn't safe, then that's not a viable option. So things for you to consider if you were to look for an underground or do some psychedelic traveling. Um, There are often retreats in Peru. The Netherlands is widely available for different psychedelic retreats. You hear some things in Mexico, and um, I think Canada has a few that I've seen. So you also have to do your research around that. Things have recently become decriminalized in Australia too. So as these happen in other countries, we're going to be seeing a lot of like psychedelic tourism happening, which can be a problem because it's very inaccessible to people. But the demand for it means that it's only accessible to people of a certain socioeconomic status. So we are seeing that the cost of some plant medicines for indigenous communities becoming priced out, uh, particularly with peyote. And there are animals where who can be harvested for different psychedelic medicines, like a toad in Mexico. They are now endangered. So things to consider alongside your values and morals as a person and what you are fighting for as a person. Now, say you, after thinking about this, you're still like, Cheryl, I really want to like consider this and pursue this. Then, a couple green flags that I recommend you look for when you're interviewing potential facilitators are they going to do a thorough assessment of your trauma history and your mental health history? Really hard to be adequately supported and contained if your facilitator isn't aware of what your various triggers and traumas are. Now, that's like a very Western, like patient history intake technique. And so I have heard of clients coming in after going to a retreat center saying that, like, oh, this is what happened and like I will never do it again and I like can't even make sense of what happened to me. And so we have to do a lot of work of going back like, okay, you weren't properly prepared for your experience. Let's go back and just go through it and see how we can heal it. So oftentimes I've had clients come in to my practice and we've had to heal the experience of the psychedelic journey because they weren't properly prepared. Um, so thorough assessment of the history. When you're under psychedelic medicine, you're in an altered state of consciousness. What that means is that you cannot consent to other types of intervention at the time. So before you ingest any medicine, it is really important that you and your facilitator have a conversation around what you are comfortable with in the event that you start having a challenging experience. Um, Under psychedelic medicines, it can be really challenging to talk. And so we use touch as an intervention, as a grounding mechanism. That usually means like a squeeze on the hand, a squeeze on the shoulder. But we talk about in what ways do you want, are you okay with being touched, and what ways are you not being okay being touched? And not every facilitator will initiate that conversation, which honestly blows my mind. So I recommend that if you're interviewing a facilitator, that you proactively bring that up and like ask them what kind of boundaries do they set? What do they do in terms of interventions? Oftentimes, people under the medicines need to move. I see this a lot with psilocybin. People feel the need to move, and sometimes um, we need to just help. We need to put our hands on our clients just to ensure that they're safe. That's also something to think about when you think about the kind of facility you take. There are stories of people being harmed um, while they're under the medicine. This has happened. You could Google it. There was a New Yorker podcast series called Cover Story that talked about how there was a married couple that inflicted harm upon participants. So thorough vetting of your provider or your facilitator around their education, what their process is, what their model is, and how well are they explaining what you should be prepared for or green flags to look for. Um, there are some things that I wouldn't say are green or red flags. Some things like the location, is it in the home? Is it in their home? Is it in like an Airbnb? Especially in the underground space. We can't go to these like hotels or retreat areas like above board and be like, hey, we're going to do this thing, is this okay? So like people find workarounds. So because it's in the underground, considering the location is important and like thinking about what is important to you as far as location and what you're willing to do and what what worries you is important to think about and also things to talk through with your therapist. There's also group and individual psychedelic experiences. um, I don't know how, like, I've seen groups as big as 8 or 12, and like usually they just add in more facilitators. The ratio that I see, I think, as a best practice, not that it's been established anywhere, is usually one facilitator to three participants, maybe four. More than that, and I get nervous about it because just like you never know what's going to come up. The flip side of the upside of individual is that if you have, like, you get all the attention. More expensive because you're paying for the person's time, but you get more of the attention. In a group, um, you like depending on what your group makeup is, you may not gel with everybody in the group that you're sitting the medicine with. But also somebody might be having a more challenging time than you and may require the attention of the facilitator more. So things to consider is like, how much can you manage on your own if the facilitators are otherwise occupied with other participants if you decide to go through the group route. There are also some facilitators who will ingest the medicine alongside their clients at the same time. Um, the rationale behind that is that they are then also on the same sort of medical, like medicine journey with you because they're on your same wavelength. It's a hotly debated thing. Some people like to ingest the medicine at the same dose that their client is ingesting it. Other people will do like a microdose or mini dose so that they're there, but they're still cognizant. Other providers will be completely sober. Um, I'm trying really hard not to pass judgment because I've only ever facilitated and done therapy totally sober. Like the thought of being under medicine while I'm supposed to be a protector scares me, so that's my bias. Um, so those are things that you would want to talk through with your facilitator and understand what their rationale is behind that. Okay. That was a lot of information. I'm hopeful that that's gotten you thinking about whether or not this is an option for you. And so I'm going to go ahead and open it up to questions now if they are there. All right. So there was one question that says, is there an average length of these phases of how long each phase lasts? I'm going to assume this is in regards to trauma focused CBT. Um, there is not an average length to any of the phases. Usually it's more of like, okay, do you feel like you have stabilized? Do you feel like this is complete? Um, I I know that the studies out there have really looked at like 12 to 16 weeks, and even like studies that look at efficacy rates of talk therapy. Um, we're just randomly picking numbers out there. Like there's a study that was like, okay, let's start with 12 sessions. And then we didn't do any session, like we didn't do that many studies that looked at like 5 or 8 or like 24. Um, we're just throwing numbers out there. So, um, and I think things are so dependent. What I tell people who like call me and say like, I want to start therapy, how long do I have to be in therapy for? Um, I I always say like, listen, like I have no idea. Like something might happen. Like we could get started and something might happen to you that sets you back. We can get started and you have like you get a new job or something fantastic happens and it really like jumpstarts your sense of hope. Like we really don't know. Now there was a question around the three phases of trauma informed CBT. It is the first phase is stabilization and we're just developing coping skills. Sorry for the thumbs up bubble there. The second is trauma narration and processing, it's where you're actually talking through your trauma and processing it. And the third is integration and consolidation. Any other questions? Please don't be shy. Usually I get lots of questions, so I like go through it. Question is DBT versus CBT. DBT is dialectical behavioral therapy. DBT is essentially almost an offshoot of CBT that really was for people. Marsha Linehan is the woman who created it. She's somebody who is living with bipolar disorder. No, not bipolar disorder, borderline personality disorder, and developed it on her own to help her manage her symptoms. DBT is actually really helpful for people who are having suicidal thoughts or having really big emotional swings. And like that, they can really help with people who struggle with like abandonment, uh, like struggle in relationships with being abandoned. It's really focused on emotion regulation. Um, there's like a really tight like sort of framework to help people with DBT techniques. I use DBT techniques for clients who are really struggling with just getting out of bed throughout the day. So it's not always just for people with personality disorders, but it's like been quite effective for people with borderline personality disorder. Um, Regarding efficacy rates between DBT and CBT, I don't know off the top of my head if they are. Um, but there's a workbook called the Dialectical Behavioral Therapy Workbook that you can just get from any bookstore that's self-guided that is really helpful. I give it to people all the time. I recommend it all the time, and it like lives on my bookshelf. So if you're interested in exploring DBT versus CBT, I would actually get that workbook to see if that's something you're driving with, and then that can help you figure out if that's a good treatment modality for you. Where do I point folks who are interested in psychedelics and don't know where to start or look? Well, that is a great question. I have not found um, any one place that I love yet. And this is going to be my shameless plug for a website that I am developing called Expanded Connections that is coming soon. I will type that link in the chat. Um, I plan on launching an education hub based off of my experiences and what I'm seeing, to like give people educational resources on how to find a psychedelic facilitator, how to learn more about what medicine they should think about ingesting as their first psychedelic medicine. There's so much out there that is written either through blogs and things like that that it can get very overwhelming, and everyone's opinion is different. And what I've found is that there's like so many people that are getting excited that they start sort of like sending this message that psychedelics are for everyone and they're going to change the world and they're a magic bullet. And that's not the case. Um, I think we have to be really careful. You really have to treat these medicines with respect and reverence in order to get the most benefit out of them. Now, that being said, there are a few other places that I really like. One of them is tripsitters.org. They're a psilocybin um, education hub for those of you who are interested in psilocybin. Um, MAPS also has, or Lycos Therapy has a website that talks about their work. I think theirs is has become, to be quite frank with you, they very much have become more of like we're gonna sell you on this like medicine. Like they've done things like they've said things in the past like they weren't gonna seek to patent their MDMA compound, but reporting has shown that some, at least some people connected to that organization have. We're really seeing the capitalization of psychedelics happening right now, which is tragic. And I think we're gonna see the efficacy rates that the stories of people saying that it's changed their lives go down as it becomes more and more medicalized, because I do believe there's a magic in them that is rooted in indigenous practices. And it's really hard because there are companies that have patented like these molecules that are like mushrooms or medicines that, you know, have been compounded or developed by chemists. It's really heartbreaking. Um, Other ones that I love are more, let me see if I can find it right now. TripSafe.org is another one. I'm just pasting in the chat that I really love. Um, they are more for recreational use, which I think is a lot of how people get into the realm of psychedelics. So I like TripSafe. They also have RollSafe, um, and that's more for like music festivals or recreational use. But I think that they are a great hub for all their education, and it's open source. Um, Other resources that I'm like, mhm, grain of salt, uses your, use with your own at your own discretion is Reddit. Has a lot of subreddits with MDMA therapy or LSD. Our Psychonaut is one that I follow. That one is a lot of citizen science, like so people who have access to these medicines and sit with the medicines themselves. Um, those are ones that take it with a grain of salt. It is just an internet form. And so, but it can be really helpful to like learn from other people, like what experiences they have, so you get a sense of what you can expect. Um, if someone is resistant to psychedelics and plant medicines, what are the next steps? Such a good question. There are a lot of reasons why somebody might be resistant to psychedelics and plant medicines. We talk about this thing called set and setting, set being like your mindset, how you feel, are you optimistic, in the setting being like the physical location of where you're ingesting the medicine. And so I have found, particularly with plant medicine, psilocybin, um, it can be really different every time. So there are times where I don't feel anything if I've had some of the medicine. There are times where the exact same dose, the exact same strain came from the same place. And like, I don't know what happened, but I had like a wild journey. And so a lot of that is more psychological barriers. Medications, like antidepressants, also can mitigate the influence. So you want to think about what medications you're on too, if they're resistant. Um, I also this is interesting because I've not been a very spiritual person until in the most recent years through the medicine work I've been doing. And so I've become, this is a little woo-woo, I'm sorry, but I really have come to believe that if somebody is not having insights or experiences under the psychedelic medicine, it's simply because they're not ready. Um, I do think that the medicine reveals things um, as you are psychologically ready for. And sometimes it's hard, but I really believe that it takes time to be at a place to be ready to receive those messages. So if you're resistant, it could be for the facilitator, it could be that there's other work that needs to be done first. Where can we find more information about the studies and research being done on psychedelics? Um, Everywhere. You can Google it, and there's like news stories left and right. There are also like the websites that I posted up there. Those are ones. If you're interested in joining a clinical trial, which is another legal way that I didn't get the chance to talk about, is, and I'll paste that in the chat, is clinicaltrials.gov, and you can Google if there's a clinical trial that you qualify for. Um, a good jumping starting point if you are new, How to Change Your Mind on Netflix. It's also a book by Michael Pollan, but watch the Netflix documentary if like the book is harder for you to like sit down and actually do. Like he talks about how he found a therapist and what research studies are out there. Um, okay, let's see here. Question around bipolar disorder and it running in the family. There have been reports that psychedelics causing a psychotic break. Um, how do I want to phrase this? There's some stories that have said that, like this is an LSD story that like they've caused a psychotic break and the person was never the same. That was later debunked. That being said, as a person who's been in this world for so long, still, these medicines like they do, right? Like they put you in an altered state of consciousness, and a psychotic break is an altered state of consciousness. So like the mechanisms are sort of similar. That being said, there are currently studies looking at psilocybin and other psychedelics with people with bipolar disorder and other what we used to say like exclusion criteria. So if you had a history of schizophrenia or psychosis in your family, you were excluded because it left you prone to a psychotic break. Now, those were like broad statements that we meant that we extrapolated from early studies of LSD in like the 70s. And so now we're actually engaging in having those studies to really understand like what the risks are. So, um, I used to give this workshop where I would talk about like, you don't qualify for this if you have this in your family history. And I had to scrap it because every time I went back to the literature to look at the research, there was a study that was actually studying that. So stay tuned. Think about it. In your work with facilitators, ask them if they've worked with people with a family history of that. I know facilitators who have been doing it for like decades who like know how to sit with folks with those with psychosis in their family or people who are prone to psychotic breaks um and like know how to work with that. Now I'm going to remind you, especially with psilocybin, there's millennia of oral history from healers and indigenous leaders and shamans that we in Western world don't know about. And like maybe we shouldn't. Like maybe we're not allowed. So if you know, if Western medicine is telling you not to do a thing, I always turn to my indigenous elders and ask them the same question. And I have found that wealth of knowledge much more fruitful for me. Um, More general question asking on resources or frameworks for people seeking support that are okay. So for autistic and neurodivergent spectrums folks, people with selective mutism and experience nonverbal episodes. I work with people who have a hard time talking, or like I don't advertise that I work with neurodivergent folks, but they seem to have self-selected due to my style. My hypothesis is that my husband is neurodivergent, and so naturally, I think I know how to like understand what people are saying. I know I can follow the threads of their narrations, and so I'm not saying I'm an expert, but I know a little bit of something around this. Other avenues like selective mutism and like things that where you can't verbally process things, art therapy. And also like therapy doesn't need to be like you sit down, you talk to someone, or you get guided through something. It could be going on a hike. It could be sitting in community with people. It could be going to peer wellness check-in groups like here. It could be coming to this. And so for nonverbal, there are ways to connect with people to process what you're going through in community without actually having to talk about it. Um, and so Um, I'm thinking about some like empowerment retreats where you're not really talking about the trauma itself or you're not talking about things, but rather you're creating, you're like journaling, doing yoga, all those things. Uh, One of my biggest dreams as a therapist is I am taking a floral arrangement class this fall at the local community college here. And my dream afterwards is to have like a survivor healing workshop one day where like we don't even have to talk about the trauma, but like let's create something beautiful together to celebrate how far we've come. And like we can think about creating things that are beautiful, coming through hardship and building that resiliency. I think that can be even more healing than like sitting down and talking about your trauma. And it looks like people are having trouble finding the resources I recommended in the chat. So I am going to, oh, because I'm putting it for just the host and panelists. Um, how do I, hmm. Carrie, do you think we can, we're at time, so do you think we can send that in an email?
Um,
Let's see here.
what we can also do is go ahead and answer it. We will send it in an email post
Okay,
comment, and I can put it in the answer for you, Natalie. So I'll do this here. There we go.
thank you. But expandedconnections.com, that's where my newsletter sign up is happening right now. Um, if you sign up when I launch, I will have a list of resources available in that launch email. And then I'm going to be putting so much education onto that website in the coming months. I have really decided to scale back some of my other clinical work so that I can launch this because more and more people are coming to me who have had negative experiences because they were not prepared. So um, do your Google, do your research, go on Reddit. But I hope to like contribute to the community knowledge in the coming weeks. Thank you so much for everyone's time today. We're at time, and I am so excited for you to get the rest of the programming this year or today.
Amazing. Thank you so much. Oh my gosh, that was so good. Thank y'all so much. We are going to have Nas come in. Let me make sure that they're all good to go. But our next part of the program is an incredible workshop. So here we go. Let me go ahead and move you as a panelist. And then I will gently move the incredible Dr. Sher. Thank y'all so much. Hello.
Hi.
All
First
right.
time as a panelist. I'm not sure if this is live now.
It is. Yes. Take it away.
I'm going to take a few moments to set up the music. Okay. Can we hear the music, Carrie?
Sure can.
Great. Awesome. Give a couple moments for people to gather their mats. I know we're just kind of back to back. So grab your mat.
A little loud.
Oh, okay.
The balance between your voice and the music. Yeah.
Is this better? Yes. I want to make sure you can hear the music too. Okay. So gather your mats, and if you have a pillow, that would be great. Something that looks a little bit like this. And maybe some essential oils and water by your side. A light blanket like that as well. And we're just going to begin by lying on the backs with our eyes.
I don't think I can hear you talking. I apologize. I didn't want to interrupt.
Can't hear me talking, or is the music too loud?
The music is too loud because the distance between the microphone. I think this is probably perfect. Yes.
Okay. Okay.
Is this
So
okay?
we're gonna all start with laying on the ground with our eyes closed. I'm gonna try to stay closer to the mat because I think if I'm too far too, it's like can't see the full visual, but I'll stay close to the computer for now. Just let me know if you can't hear me again.
Thank you.
Take a few moments here to take 3 deep breaths. We're gonna inhale through our nose and audible exhale out of your mouth. 2 more just like that, laying on your mats and just noticing where your body's touching the ground. Gentle inhale through your nose, feel the air fill up your lungs. And as you exhale, gently feel the air come out of your mouth. Allow yourself to ground deeper into your pose. It's our first Shavasana. And notice where your mind is today. Is there a way for you to carve out this space for the next 20 to 30 minutes just for yourself? To trust that whatever you have to tend to after this session and wherever you're coming from, that they'll stay right where they are. Allow your breath to come back to neutral. And find yourself in a comfortable seated position, perhaps with your legs crossed in front of you. Giving yourself plenty of time to ease out of your Shavasana. Rest your palms on your knees. And as you inhale, I want you to guide your right arm up towards the sky, resting your left fingertips on the ground by your side as if you're propping yourself up. And as you exhale, gently place that left palm onto the ground and tilt your body over to the left side. Option to bend your left elbow to deepen your stretch into your pose, feeling that stretch on the outside of your right side, keeping your glutes grounded on the floor. Inhale, come back to center. Exhale, relax your lifted arm. One full breath here in seated mountain. Next, inhale, guide your left arm up this time. And as you exhale, gently place that right palm, letting it meet the ground, tilting over to the right side. Feel that stretch expand on the left side of your body. Breathe here. Inhale, come back to center. One more round, just like that. Exhale, relax that arm. One full breath at center. Inhale as you lengthen your spine. Exhale as you relax your shoulders. Inhale, right arm comes on up. Exhale, tilt over to the left side. Option to bend that left elbow to deepen your stretch. Inhale, come back to center. Exhale, relax that right arm. Last one on the other side at your own pace, following your own breath. As you inhale, left arm comes all the way up. And as you exhale, tilt over to the right side. Notice how it feels to arrive in these poses in the second time. Does it feel a little different than it did the first time? Breathing here. A few more breaths. Neutral breaths at center. Next, inhale, bring your left arm up. And as you exhale, drop that left palm onto the top of your spine. Next, inhale, bring your right arm up and over, grabbing your left elbow and just getting a stretch on either sides of your body. Keep your necks relaxed, your shoulders relaxed. Keep your upper body lengthened. Last few breaths here. Gently release your arms, one full breath at center, just to reset for a moment. Next, inhale, right arm. Exhale, right palm top of your spine. Gentle inhale, left arm comes up and over, wrapping your right elbow. And breathing here. Take a moment to notice each spot in your body where you're feeling this pose. Perhaps your upper rib cage, or your shoulders, or your outer arms. And gently breathe into the spaces where you're feeling this pose the most. And gently relax your arms. Relax your palms on your thighs or on your knees. A couple of neutral breaths here, just grounding through your ribs. And then we're going to gently come into tabletop, shoulders above our wrists, hips above our knees. And you want to prepare your pillow here if you have one, or a rolled up towel, just to relieve that pressure underneath your knee. Let's do one cat-cow first, inhaling head up, belly down. And as you exhale, curve your spine the other way, tucking your chin into your chest. Allow your spine to come back to neutral. And we're going to step our right foot close to the edge of the right side of our mat. Our left knee stays on the ground. Option to place that pillow below your lower left knee. Completely okay to choose what option feels good for you today. Place your hands in front of your right foot so you can just get a good stretch on the front side of your left hip. Option to keep your hands right where they are. Or option 2 is keep your hands on top of your right knee. We're often sitting for most of the day, so this helps us stretch out the front side of our hips. We're going to breathe here, and you can play around with the movement of your hips forward to deepen your stretch, or push yourself out of it to come out of the pose a little more. Take deep breaths here and allow yourself to just honor your body where it is today. Slowly push yourself out of that pose. We're going to lengthen out our right leg to get that stretch behind our right legs. And then step your right knee back, setting ourselves for the other side, stepping your left foot forward. Take a moment to adjust the placement of your right knee. Hands come on the inside of your left foot. Deepening that stretch, pushing your hips a little bit forward. Option to keep your hands right where they are. Full breath here. Or option to place your hands onto your left knee. Deep breaths here. Stay grounded in your foot, your knee, supporting that knee as much as you need. And then lengthening out that left leg, pushing your glutes back. Keep your spine as straight as you can over the top of your left leg. Slowly come out of that pose and put your left knee next to your right. Coming back to tabletop, shoulders above your wrists, hips above your knees. Inhale here. We're going to lift up our right arm. And as you exhale, thread the needle with your right arm through the hole beneath you. And you're gonna place your right shoulder onto the mat. Option to keep your upper body just relaxed, or you can push your left palm into the ground to deepen your stretch, opening yourself up a little more in your twist. We're gonna come back to center, come back to tabletop, and flow through one more round of cat-cow, following your own breath here. As you inhale, lift up through your head, belly down. And as you exhale, curve that spine, lead that midpoint in your spine up towards the ceiling. Tucking your chin into your chest. And come back to neutral whenever you're ready. Setting ourselves up on the other side, left arm comes on up with your next inhale. And as you exhale, thread the needle onto the right side. Place your left shoulder onto the mat. An option to keep your right arm relaxed or engage as it pushes into the ground, opposing strength, helping your right shoulder open up towards the right side. Stay right where you are for a few more breaths. Come back to center, come back to neutral, and we're gonna gently sit back onto our glutes. Find a comfortable seated position, ideally with your legs crossed. Place your hands on your palms. And just a few gentle breaths here. Taking these moments to notice what your body, your senses are picking up. How's the temperature in your space? Is it running a little cold, a little warm, or just right? Do you find yourself wanting to get away from your mat, or you feel completely comfortable in this space right now? When you allow yourself to be completely present for yourself, then we're going to do a slight twist. You can stay right there if that's what your body needs today, to just sit still in our pose, sitting pose. Or you can gently place your left palm on your right knee, your right hand behind you, and just a slight twist toward the right side. If you want a deeper twist, guide it with your right shoulder and not with your head or your neck. Slowly coming back to center whenever you're ready. One full breath here. And then on to the other side whenever you're ready. Gently coming back to center. And then finding your way down onto lying on your backs once again. Keep your eyes closed or gently open if that feels accessible to you. And you're more than welcome to just lay in the Shavasana for the remaining time of our session. Or I'll be guiding us through a couple more poses. We're going to stay in them a little longer. And if you're joining us for that portion, you're going to inhale your right knee into your chest, breathing in deeply. And as you exhale, use your left palm to guide that right knee over your body towards the left side, a slight spinal twist, and you can even extend your right arm behind you. Option to use that pillow to prop below your right knee. And just allowing your body to settle in this pose. We're going to be here for a few minutes. As if there's an imaginary string from the right side of your shoulder, tugging all the way through your right knee on the other side of your body. And continue staying with your breath in this pose. Keep your breath full and lengthened. Gently coming back to center whenever you're ready. One full breath here at center. And to set ourselves up on the other side, begin to inhale your left knee into your chest, using your hands to support you. And as you exhale, guide that left knee up and over towards your right side. Left arm extends behind you. Notice how it feels to allow your body to land in this pose on the other side. And just allow yourself to breathe into the spaces of your body where you're feeling this pose the most. Last few moments on this side. Gently unravel yourself back to center, bringing yourself into our final Shavasana, laying on our backs once again with our eyes gently closed. Option to lengthen your arms above your heads on the ground for one last deep stretch, as if you're taking that stretch for the first time in the morning. Just inhaling all the way up and pointing your toes the other way. Extending your body as long as it can, holding your breath at the top of your inhale for 5, 4, 3, 2, and 1. Gently relax your body, place your arms where they feel comfortable, taking as much space as you'd like in your home, in whatever space that you're meeting us in today. Allow yourself to unwind in these final few moments, getting real comfortable, lengthening your neck, relaxing your shoulders into the ground, and just noticing your belly rise and fall as you breathe in and out. Can you allow yourself to enjoy the moment without needing to achieve or strive? Just enjoying your being. Closing our time together today with a passage for August 3rd. Learn to be present. I haven't been able to give you much materially, he said. Not jewelry, diamonds, gold, but the gift I've given you, what I've had to offer, is staying fully present for you. Presence is a gift. Staying fully present for friends, family, ourselves, our lives. Staying in the moment with our hearts open will change other people's lives and ours. So often we've learned out of habit or fear to be only partially present, partially conscious for ourselves, others, and our lives. We aren't certain what we're feeling. Our attention and energy are diverted to the next place, the next person. We're there, kind of. There's another way, a better way, one where we keep our hearts open and know what we feel. We take the risk of being vulnerable enough to share who we really are and to allow others to do the same. We become fully present for each moment and each person on our path. Yes, there are times when it isn't safe to be open, when the energy of a circumstance isn't right for us, but that usually reveals a lesson and dictates a choice. It may be time to learn, time to leave, time to feel, time to choose. Learn to release all that stands in the way of you and the present moment. Learn to let go of all that blocks you from being fully present for yourself and others. Give the gift of presence to yourself and to the world. And with that, let's take one last deep breath here together, in through our nose. Audible exhale out of your mouth whenever you're ready. Allow your body and breath to take as much time and movements as it needs to come out of this final pose. Thank yourselves for showing up today. And thank you for sharing your practice with me today.
Thank you so much. That was incredible. Thanks, everybody, and thank you. There's a question for where are the quotes from?
Yeah, I was just about to type it. So you can tell that this book is very well loved. It's called Journey to the Heart, and Melody Beattie is the author. There's different kind of quotes for each day. And so usually I just flip it to the day that I'm hosting the class, or I just feel like opening it up. And yeah, I recommend it. I just leave it on here in case anyone wants to take a photo. Um,
Well, thank you so much. That was so wonderful.
Thank you for having me and being patient with the music and everything.
Oh, that was fantastic. Okay, we're gonna take a little break. So we have about half an hour until our next program. So please stay tuned for that. So we will just kind of go ahead. I'll leave this space open. I'll probably play a little bit of music as well. If y'all wanted to just sort of hang out a little. If not, we'll see you back in about half an hour. So 11 a.m. for our very first panel. Really excited for that. So thank you again. A huge shout out to Dr. Cheryl and Nos, and we're so excited to continue the rest of this summit with y'all. Thank you so much.